All right, it is 11 o'clock, so we're going to go ahead and get started. Um, I put in the chat as well, but a few housekeeping things. If you can remain muted throughout the presentation, it'll just limit some background noise. Feel free to have your cameras on or off, whatever you're most comfortable with. We just ask that you pay attention to the material being presented. But my name is Allie Shipman. I am the Parent-to-Parent Program Coordinator here at the CED. And you are all here today for the July Virtual Speaker Series, Foster Care and Disability, Supporting Children and Families. And we are welcoming Kate Kosydar from Necco. She's a licensing specialist. She'll tell you her presentation is all about foster care and disabilities. So welcome, Kate.
Awesome. Thank you. Hi, everyone. I'm Kate, and I've been working with Necco for about 2 years as a licensing specialist. And that just means that I train and certify families to become foster families. I do a lot of trauma training with those families. And as we're going to talk about, there's a lot of, overlap
I
between
just
trauma
listened.
and disabilities. I'm also a foster parent and a parent of bio kids. I have two kids that are level one autism, diagnosed with level one autism, and we have a teenager foster child in our home, and he also has autism and ADHD. That's just a little bit about my background and where I'm coming from. Foster care is a really complicated system. And I bring kind of those two perspectives, but there are lots more perspectives that there are to have. So I'm going to go ahead and share my screen now, and we will start. Okay, I'm really hoping that the tech will work. Great. Can you all see the screen properly? Okay, perfect. Thanks. Okay, great. Here we go. So, kids with disabilities who are in foster care are navigate. You know what? I missed a slide. Hold on one moment. It's always like freaky starting because the tech is. I'm going back and forth between Teams and Zoom, and so I have to like relearn Zoom when I come back in. So hold on one second. Okay, so here's what we're talking about today. First of all, why are we talking about this? When we think about kids who are in foster care, when they also have a disability, they have to navigate two different systems at once. So we've got the child welfare system, but also the disability, the medical, the education system. And those two systems don't always talk to each other. And so when there's that gap, that's where kids can fall through. And so we're talking about it so that we can kind of help to close that gap in our own practice. So by the end of today, these are what we promise. You'll be able to understand the unique needs of kids with disabilities who are also in foster care, identify ways to support their development, their behavior, and give them that extra access to services that they need. Well, we're going to recognize why maintaining family connections really matters in a special way to these kids, especially for kids in care. And then describe what transitions, including reunifications, looks like for this population and how we can support those transitions. So this is not a lecture. Okay, you will be doing most of the thinking today, and I'm just going to be kind of guiding the way that you're thinking about some of these things. We're going to use the chat function a lot, so hopefully you are familiar with that. So before we start with like frameworks and any of that stuff, we need to remember that all kids are unique, right? So we get to ask ourselves over and over again, who is this child that's in front of us right now? So to start, I want you to think of a child that you've worked with. Someone, maybe you are a foster parent, maybe you've fostered a child with a disability, but maybe you've just supported a child who had a disability. That could be physical, developmental, sensory, medical, behavior, any kind of disability, whatever comes to mind. Okay, think about that child. You don't have to think of identifying details. Just think about a moment where you were with them. So I want two things from you in the chat right now, okay? First of all, what is one thing that made caregiving easier with this child? And what is one thing that made it harder? I want you to take about 90 seconds to think, and then we're going to drop both in the chat. So pause. Don't do it yet until I say go, okay? So I want everyone to kind of hit send at around the same time so you don't feel like you're the first one going alone, okay? So just take a couple of seconds, and when I say go, go ahead and drop those things in the chat. All right, what's one thing that made caregiving easier with this child? And what's one thing that made it harder? Go ahead and hit enter when you're ready. Awesome. Thanks, everyone. All right, so a couple things I'm seeing. Having someone that validates you, professionals thinking that they know their child better than me. Yes. Things that are easier, they stick close to me, harder, the fear and or anxiety of other people. Having patience or having a lack of understanding. Thank you so much, everyone. Sometimes it's easy building a rapport, getting to know them, but it could be harder not having the background information to go on. Yes, we're going to talk about that for sure. When we have support, that makes it easier, that sense of community. But when we don't understand, that makes it harder for sure. Awesome. So there are, quite a few different challenges, different opportunities that we have. But as we go through the rest of this presentation, this conversation, hold on to that, right? Everything that we cover today is going to end up mapping back to one of these two lists. We're going to map back what are things that make it easier, what are things that make it more challenging to serve these kiddos. So we're not learning something generic today. We're actually learning how to expand that list of easier things, okay, for these specific kids. All right, so when we say disability in foster care, there could be a wide range of things that we're talking about. There could be physical disabilities, could be intellectual or developmental disabilities, could be sensory, like vision or hearing. There could be medically complex conditions, things like, neonatal abstinence syndrome, or, when a baby is, sorry, of course, the word is going to leave my brain right now, but when they're exposed to alcohol in utero, that can affect them over the course of their life. Then there are also emotional and behavioral disabilities. So a child could have one of these issues, these struggles, or they could have several that are stacked on top of each other, right? But here's the piece that trips people up the most. Disability and trauma can look really similar from the outside. So when a child who shuts down, who has meltdowns, a child who can't follow a two-step instructions, those could be a processing disorder, or it could be a trauma response. And sometimes it's both at the same time. Having a disability like this doesn't cancel out the trauma that a child has experienced, and neither does the trauma cancel out the disability they're experiencing. And so there's a pitfall that we need to avoid when we're caring for these kids. And that is treating a child like a diagnosis on paper instead of actually taking care of the whole person who's in front of you in that moment. One thing I want to point out is that any diagnosis, it only tells you what to watch for. It doesn't tell you who the child is. So kids with disabilities who are in foster care are carrying these two vulnerabilities at once. There's the instability of the system, the foster care system, and there's the disability itself. And those things compound. And that compounding is real, and it's why these kids need really intentional support. Their challenges show up in a lot of different ways. So for kids in care who also have a disability, there are layers. Foster kids will often experience a placement disruption. But for a kid who's also has a disability, that placement disruption, it's not just about going to a new house, right? Finding a new family. It also means a new therapist, a new school, a new IEP process. It means starting from scratch in a lot of different ways. It's a whole new set of adults, not just the foster parents, but the rest of the adults in their lives who don't yet know who they are or their communication style. Every transition costs this child even more than it costs a child without a disability. So that's why we're going to talk about a checklist and a service navigation piece in a minute. And it's so important. When I talk about this next session, I want to point out I'm not just talking about paperwork for paperwork's sake. This is a way to protect continuity for a kid who is especially vulnerable if they lose that continuity. So here's a scenario. A child arrives in your home with an IEP in their file, but nothing else. They don't have any other records, no therapist contacts, no medical history. So drop in the chat. What are your first 3 questions? What are you going to ask? Go ahead and drop that in the chat as soon as you're ready. Great, thanks, Brooke. What challenges are they facing in school? Yeah, that IEP that you have access to isn't necessarily going to describe those challenges, right? What is the actual disability that they're diagnosed with? Great question. What accommodations do they need? What do they like? I love that, Christina. Thank you. What services or supports have they had in the past? What do they need for their daily routine? These are great questions. So you might be asking about the diagnosis itself, right? You might be asking about current providers. Somebody already mentioned the daily routine. What are things that have worked before for this child? All of these things matter. And notice that these questions are all bigger than what does the IEP say I have to do? Right? The IEP is just an important but a very small piece of the puzzle. So we need to be asking, who is this child questions first. And that's exactly what you all put in the chat. So thank you. So we've named the spectrum. of disabilities. We've named why this population is especially vulnerable to instability. So now we're going to get a little bit practical. How do we actually support the development, the behavior, and their access to services on a daily basis? So let's get into the systems piece first, because this is where we have these good intentions and they run into the paperwork, right? So if a child is under age 3, there is the IDEA Part C, and you can have a plan called an Individualized Family Service Plan for kids under 3. For kids who are school aged, you could be dealing with either an IEP, Individualized Education Plan, or a 504 plan. But beyond the education piece, there's also other systems like Medicaid, waiver services, therapy referrals. And that could be for OT, for PT, for speech, and then also just other therapy, right? For a foster parent or a case manager or other professionals, we're not just like passengers in this system. We actually get to advocate for the kids. So that means we show up to meetings, right? We ask important questions. And when something doesn't add up, we dig into that. We get curious. And we push, right? When a service is getting delayed, you know that a kid needs something, we push to ensure that that child gets what they are needing in that moment. So this is a tool that you can kind of create for yourself, and you can use this with each individual child that you're working with, right? And this just involves building a very simple services checklist for every child with a disability who you care for. So information you could include in this could be their diagnosis. You know, as we discussed earlier, like that is really critical information to have. Who are their current providers? When we have any kind of transition, knowing the current providers means that we can more seamlessly transfer their care, right? We can get information from their providers to the new providers. What are their upcoming evaluations? What's on the horizon for them? What are their current medications? That's critical too, right? And what is each medication prescribed for? So when we have a resource like this, when we build a resource like this for ourselves and the child, we need to keep it updated. And remember that this is one document that could mean the difference between a smooth transition and a lost month of care or progress for a child, right? So we're going to talk a little bit later on as well about where you might use this checklist. But it's helpful for yourself in the moment. But as the child's care continues through the foster care system, it is really beneficial, or especially beneficial, just kind of moving through their time in care. Okay, so communication. Some children in care are not able to tell you what hurts, what's overwhelming, what they need. And it's not because they don't want to, but it's because of how they communicate. So sometimes kids use an AAC, augmentative or alternative communication, maybe a device, picture cards, sign. So when we can learn even the basics of their system, that's one of the highest impact things that we can do. We don't need to become an expert overnight, but when we're committed to learning what the child uses, that allows us to be a meaningful advocate for the child and with the child. What this all comes down to is the child should not need to be responsible for creating that bridge between themselves and all the adults in their life. You know, we get to be that person who actually advocates for them and creates that bridge with them and for them when appropriate. So behavior, this is a trap that I talk to foster parents about all the time. Okay. And it's really critical that we avoid this trap. Okay. We cannot treat behaviors as either just trauma or just the diagnosis. Both of those explanations can be true, but when we look at a behavior, neither one of those explanations really tells us what to do in the moment. So, what helps is actually a trauma-informed response to the behavior. Okay, and that includes things like grounding, offering predictability, offering choice. And we apply that response, that trauma-informed response, alongside any other supports that are specific to the child's disability. So think about this. When a child is having a meltdown, what could that be the signal of? It might mean that they need a sensory break and not a consequence. When they're refusing to do something, that could be a communication gap and not a sign of defiance. There's no universal protocol that we have access to for these kids because it genuinely depends on the individual child and honestly the individual moment with that child, right? So, services, communication needs, behavioral supports. These things can all be included in an IEP or an IFSP, right? So, based on what we've talked about, let's do a quick check-in in the chat. So 1 being not at all or 5 being very confident. How confident do you feel right now walking into an IEP or an IFSP meeting for a child with disabilities in your care? How confident are you? 3, okay? Yeah, 3 and 2. Thanks for weighing in. So that's honest and expected. When you're sitting at a 2 or a 3, this is why we talk about building that checklist and why it's so important. Okay. When we have access to, or when we create access to more knowledge about the specific child, that is going to be something that supports our confidence when we're walking into these meetings. I remember walking into an IEP meeting for the 17-year-old I have in my care. I had no idea about his background in a lot of ways, and his case manager didn't either. I didn't have access to his department worker at the time, but the school was able to pull like some of his records, right? And we had no idea how many schools he had been in over the course of his life. And the number was staggering. I don't recall what it was right now, but he was in 11th grade at the time and he had been in a lot of different schools. So not having that context before we walked into the meeting made it a little bit more difficult to advocate for him inside that meeting. But we gather that information, right? And as we get more information about each child, we develop that checklist, we gain confidence and we gain that ability to advocate for them. Let me just check the chat. Okay. So it's not about knowing everything. We're certainly never going to really know everything about the child pretty much ever, right? There's going to be holes in our understanding and in our knowledge about the child. But also, it's not about knowing everything about the system. We don't need to have all of the answers. What it takes is to walk into that relationship with the child, asking the right questions. So I hope that helps, that perspective helps. All right. So we've covered a lot of practical ground. Now we're going to shift into kind of that relational piece, and we're going to talk about family connection. So children with disabilities who are also in foster care are at a higher risk of losing contact with their birth family and with their siblings. And that's not because anyone decided that that should happen, but there are logistical pieces that really affect the kids in care. So, for one thing, specialized placements like foster families who are able to meet the needs of kids with disabilities are not always in the same county that the child, their home county, right? So they may have to move far away from their home county. It can be really hard to coordinate visitation. So those supervised visits between the child and their bio family. It's hard to coordinate because the child also has all these other schedules to think about, right? Therapy schedules, medical appointments. So that distance can add up, and those logistical issues, all that means is that the connection between the child and their bio family can quietly erode. But disability does not reduce a child's need for that connection to the people who knew them first. I mean, if anything, their birth family and their siblings often hold information that no file could ever capture. What soothes the child, how they communicated before they had words, what their routine looked like at home. That information isn't only sentimental, it can be, but it's actually really useful information. It's information that we can use to really help this child today, things that they experienced in the past. And we can't really get that information anywhere else in a lot of ways. So, practically speaking, what does it look like when logistics are working against you? So, we can set up video calls, and we do this in partnership with the department, with the child's department worker, with their agency worker, whoever, there are lots of people who are on a child's team when they're in foster care, right? So we can make sure and advocate for video calls when those in-person visits aren't possible. When they do have in-person visits, advocate that they have sensory-friendly visit spaces. Maybe that's quieter rooms, places with fewer people, offering them a predictable structure for those visits. And that can really go a long way to help that transition. And then we can also, as workers, as foster parents, invite the birth family into learning about the child's current needs. What is their communication system? Like, what are they learning? What is their routine like today? When we do that, when we invite the bio family in, especially when they're on track to reunification, then they can become and remain engaged in the child's care even before that reunification happens. So none of these things erase the logistical barriers, but they do keep the door open. Okay, and it means that we get to choose, we get to advocate for the child instead of letting these logistics kind of make the decision for us. Like, what are we going to do, right? We can advocate and make things happen. So why do you think that communication matters even more for a child with complex needs? So just type in 1 or 2 sentences in the chat. Why is connection even more critical for a child who has a disability? Thanks, Paula. There are so many moving pieces to keep track of to best support the child. They need someone they can depend on to be there. Yeah, so those connections, that's who they can depend on, right? Help them thrive. A special needs child always responds best to consistency and routine. If there's too much change at one time, it's not in anyone's best interest. Thanks, Rachel. It's a really great point. Sarah says it may depend on this connection. Yeah, the child may depend on the connection. Helping them feel understood. I love this. Love does not always need to be communicated. It can simply be felt in the presence of their loved ones, for sure. All right. Thanks, everyone. Appreciate that. So we're going to kind of hold on to that importance of connection, okay? Because now we're going to talk about the transitions where this connection can either be protected or it can be lost. All right, so transitions. This could mean moving to a new placement, a new foster home, or it could mean reunification or returning home to their biological families. To start, just to point out, for every child, this transition is a disruption. But for a child with a disability, that disruption can also mean losing that continuity of care. And it probably took months to build them up to the point where they are today. And if we lose that continuity, it's likely that they'll fall through the cracks, that they'll backslide, that they'll lose some of what they built up. So that's when we talk about the transfer, here are some things that need to transfer between ourselves as the current care providers and their next care providers. So that services checklist that you built, okay, the thing that has their diagnoses, their providers, their evaluations, their current medications. So we can pass that services checklist on and give the new caregivers that head start. All of their records, like their IEP or their IFSP, right? So their receiving school or program isn't starting the evaluation process from zero. They can pick up where they left off. And then this warm handoff between therapy providers, that it is not always possible, but when it is, it makes a really big difference. And this is more than just sharing notes or transferring files and records. That warm handoff hopefully involves a conversation between the therapy providers. And that is going to really help ease the transition. Again, we're talking about a child, not a bunch of paperwork, right? The paperwork supports the child. It is not everything about the child. And then, of course, again, having that warm handoff about the child's current routine, the communication system, and really having that conversation, explaining to whoever is kind of receiving the child, becoming the new caregiver, helping them understand what the current routine is so that they can take that into account as they are building the new routine with the child. Then beyond the paperwork, the child is also having an experience of the move, right? So we need to take into account trauma-informed principles when we are facilitating the transition. So things that really help are predictability, preparation, and of course, involving the child at their specific level of communication. So that last part matters here more than almost anywhere. So if a child is using, an adaptive communication device or has any kind of limited verbal communication, preparing them looks very different than if they are not dealing with a disability, for example. So preparing them is not a 5-minute conversation the day before. right? It can mean a lot of different things, and it's going to depend on what the child actually needs. It could be a visual, a schedule, some way to practice or role play with them about the new space, the new family. Looping in whoever helps them communicate and helping them to explain or helping explain the change in the child's terms. And that's going to make the difference. So one more thing I really want to point out here is that reunification is not the finish line. Services should not stop when or if the child gets reunified. So as birth families are stepping back into their role as full-time caregivers, they need the exact same support that we need as their foster, the support that we get for them while they're in foster care. So they might need support in how to navigate the IEP process, how to advocate for the child in a doctor's appointment, how to read and even create their own services checklist. So when we are able to build a checklist with a child over time, and then we can give that to them to the birth family at reunification, that gives them a running start and it gives them a real chance at success. Okay, so in a lot of cases, kids are in foster care for months or years. And so it may have been quite a long time before the bio family has really been in that full-time caregiver role. So when we can give them you give the bio family, the birth family, as much support as possible, that sets them up for success. Okay, so in the chat, 1 to 5, how ready do you feel right now to support a child with disabilities through a transition? And what's one thing that you could use to help you increase that? So Rebecca says social stories could help. Rebecca, I think you're saying that social stories can help the child in that transition period. Is that right? Thank you. Yeah. Yeah. So that really helps the kids identify what's coming down the pike and helps them imagine and get that support to thrive in the new situation. All right, clear communication is good. So Shannon and Christina both need clear communication and preparation for sure. I'm going to tell on myself a little bit when I think about, welcoming a new child with disabilities into my, as a foster parent into my home. I'm not sure I feel that confident. Even having all of this, training and experience and things, everything for me, it's just so child dependent. You don't really know what you're walking into until you have some experience with the child. Okay. Oh, great. Some more answers. The birth parents should have been receiving services to assist them. Yes, Rachel, that is best case scenario. They do receive services to help them prepare to take on that caregiving role. And that hands-on follow-up care for kids, yeah, to support both the kids and the families is absolutely critical. On my end where I sit, I'm not as involved once the reunification takes place. So I'm not clear on, statistic or even anecdotal, how that works on a child-to-child basis. But my hope is that families are receiving that support when there's reunification. And then having that checklist and good communication to make sure that caregivers and providers feel comfortable supporting that child. Perfect. Yeah. So, Brooke, you're saying that's something that could help increase your confidence for sure. Yeah. Like in the story that I told before, that would have been, a checklist like this would have been really helpful for me in getting ready to care for the child in my care. But, sometimes we don't have that. And now that I know, I can be advocating that he has that as he moves forward into the next step, right? All right. So, what are some questions that are coming up? You know, I'm going to stop sharing my screen now. And we're going to do this. So, yeah, I invite you to, either come off mute or put your questions in the chat. We can kind of talk about some things that are specifically coming up for you around foster care and kids with disabilities in foster care, if you have any.
Do you see a lot of um, kids come through Necco specifically with disabilities? And is there any specific trainings that the potential foster parents would be doing to accept the child with a disability?
Yeah, great question. So most of the disabilities that we see, and this is not like from a spreadsheet or anything. This is just like, oh, in my head. ADHD, autism are fairly common diagnoses that kids in care have. And it's complicated because, that like we talked about earlier, the trauma can mimic some of the symptoms that we see with ADHD and autism. So, for example, if a child has been neglected, they've been, kept in a room and not taught to talk. Nobody's really talked with them, they haven't taught them to speak or whatever. It can kind of be diagnosed as, nonverbal autism, but then it could turn out that it was just the a symptom of the neglect. So we do see those diagnoses kind of more often, and sometimes that is true, that is the diagnosis. And sometimes we see a big turnaround once they're in a family. Um, was there another part of your question? Sorry, Allie.
That's okay. Just if the potential
Oh,
foster parents have any special training or anything to accept the child like that.
perfect. Yes. So we definitely do extensive trauma training, which again, a lot of the trauma-informed practices do support kids who have disability, especially when we are talking about the behaviors. That trauma-informed response is, in a lot of ways what a child who has, autism or ADHD needs. Really, it's just about what is the child seeking right now. This behavior needs to tell me something and not just be treated as something that needs to be corrected or punished, right? And so there's that. And then we also have, ongoing training opportunities that if a foster parent has a child who's, struggling with something specific, like neonatal abstinence syndrome or something like that, we do have additional trainings that they can participate in for sure.
Thank you.
Yeah. Anyone else have any questions? Okay.
Hi, Kate.
Hi, Brooke.
So I'm actually a parenting provider and supporter counselor for kiddos who are in the CSED program.
Uh-huh.
And so when I see sometimes is when kids are reunified with their biological families that they're actually not getting services. So are there specific trainings or services that you would think would help biological families during that transition?
Yeah, I mean, what we call them for our foster parents is child-specific trainings. So again, if you have a foster parent who is caring for a child with a specific, condition or diagnosis or behavioral issue or something like that, we would encourage the foster parents to get knowledgeable about the diagnosis as well as, how to support the child inside that, right? Um, I guess it's not surprising to me that the families aren't getting, or that you're seeing that the families aren't always getting that support. And so we use a plat. I don't know if are you asking for like specifically where our trainings come from, or
Yeah, like if you
yeah.
have any recommendations for that.
Necco uses a platform called Just in Time Training. Um, and they have, I mean, hundreds of trainings that can be very child specific. So you can like search what is the foster family dealing with, and that's what we have them do, right? And so that might be one thing. Also, just again, that general trauma training. I think for bio families, what we see a lot is that they have experienced trauma themselves, the parents, right? And so, um, if they are getting support to work through their own trauma, that is, I mean, I wish and hope that for everyone, right? But then also like helping the parents to see what signs of their child's trauma is coming through in behaviors and giving them those resources and support to deal with that. I wish, and I'm not sure that it's true, I wish that the parenting classes that the bio families went through was kind of hands-on and like specific to their child versus just like getting a certificate and I'm not sure how many counties have the resources or are able to give the bio families that support. It is definitely an imperfect system.
No, absolutely, but that was helpful. Thank you so much.
Okay, good.
Any other questions or comments?
Well, I'm not sure what everyone's background is or how you are working with these kiddos, but I do want to just say thank you for whatever it is you do. This is, I work with kids in care, but there are lots of different kids who need different support. So thank you for being there and in their corner. Um, and I guess I should say, if anyone has any interest or curious about foster care specifically, whether you're talking about caring for a child with disabilities or, not, I would be happy to talk with you and just answer any questions you have. And I guess I can put my contact information in the chat. You can email me or
Yeah.
call me.
Yeah, and if anyone has any other questions, feel free to email me too, and I could forward them along to
Oh,
Kate.
yeah, that'd be
Um,
great.
and I don't know. Well, thank you all for being here. This session is recorded, so you can view it on our websites. In a few days, it'll be ready. and up on our website to view. So if there's no other questions, thank you so much, Kate. It was very helpful. The session was very helpful and a lot of information, helpful information. Um, so we thank you for being here.
Thank you
All
all.
right. Well, thank you. Have a
Bye,
good
everyone.
day, everyone.
Thank you.